So welcome to Module 10C. Good afternoon, everyone. Remember in our previous module, we've been talking about since the beginning of this module 10A, 10B, and this is 10C. We're talking about taking care of family budget, family expenses, family finances. So today we are talking about the introduction to care of the home and personal belongings. Introduction to care of the home and personal belongings. I believe we all know the importance of care of the home and care of personal belongings. You know that I'm talking about care of the homes. The first thing that comes to mind is what is personal hygiene. Both personal hygiene, environmental hygiene, care. So care covers the care of the home, covers every aspect of the home, taking care of every aspect of the home. Why? So that the home can be what conducive for living in. And why do we care for personal belongings? To increase their durability, to increase their lifespan, and to increase even the health of the owner of that belonging. So without wasting much time, we're moving to the introduction part. Maintaining a clean and organized home is an important task of the home health aide or personal care aide. And it helps to provide a home free of infection, pests, and also promotes good hygiene and physical and psychological well-being. Now, this is combining so many things together. Let's break it down. When you maintain a clean and an organized home, this is an important task of who? Of the home health aide and personal care aide. Now, what is the function of maintaining clean and organized home? It's helps to reduce the risk of what? Infection. Because why? Wherever there are dirt, of course, infection is not far-fetched. Also reduce the risk of pests in the home, and it also promotes good hygiene. It helps to promote what? Good hygiene and physical and psychological well-being. It also promotes this physical well-being and even psychological well-being. And this module will explore the purpose of housekeeping and also to discuss how housekeeping in a patient's home is different than in one's home. I repeat, this will help us to discuss how housekeeping in a patient's home is different in one's home. So housekeeping in your house is different from the housekeeping in your patient's home. So we'll learn the importance of using proper body techniques and how to prioritize tasks in order to be efficient as possible. And we'll also explore different types of cleaning products and why each are used. Finally, we will discuss important housekeeping tasks to be completed in each room of the house, as well as how to do laundry. So let's move straight to the big deal, the business of the day. Importance of housekeeping. Housekeeping is an essential task of a home health aide or personal care aide. It helps to enhance a patient's quality of life. Enhance what? The patient's quality of life. And when a patient's home is clean and organized, it helps them to feel better psychologically and also keep them safer physically. So during these times, or the times of illness, there may be much stress, disorganization, and even chaos in the family or in the home. So becoming ill and dealing with diseases, disability, and injury can be very, very stressful. It can also occupy a great deal of the patient's and family's time, which leads towards requirement of assistance with keeping their home clean. Now, helping to keep the patient's home clean and safe is one important way that a home health aide or personal care aides can help the family during their time of needs. Now, this is an example of a home health aide helping to clean the furnitures, the walls, the glass. So having a clean home is important for what? Infection and control. To be able to control infection, you must have a clean home. It is not negotiable. Proper disinfection, it removes what? Microorganisms. When you disinfect properly, what is disinfection? Disinfection, meaning what? Removal of what? Infection. And what are those infective organisms? They are what? Microorganisms. The microorganisms are bacteria, fungus, and viruses that can cause disease. Maintaining a safe and clean home also helps them to prevent what? Accidents and further injury or disability. Tidying up on a regular basis allows home health care or personal care aides to prevent mental falls as well. So aside from preventing them from infection, it also prevents what? Accidents. So when you tidy up the home regular basis, there wouldn't be cracks of maybe probably broken bottles or sharps or oil on the floor that would make the patient slip and fall. To prevent what? Risk of what? Accidental falls. Now many people may take great pride in their home. When they are sick or disabled, they may not be able to maintain their home the way they used to or they would like to. So with the assistance from a home health aide, a personal care aide, you can have a living space that reflects the pride they have in their home. Some patients may not have good knowledge of how to maintain a clean home. So with the support of a home health aide or a personal care aide, the assistance of these people, they can learn, you can teach them the proper cleaning techniques and also household management skills. Now, having the knowledge, this knowledge will enhance a patient's independence, self-esteem, and ability to feel control in their life and comfort. So when the patient lives in a dirty environment, he feels less of himself, especially when he wants to entertain visitors. So to help the patient to increase self-esteem and self-independence, also a clean home is key and is important. Performing housekeeping. So how do we perform housekeeping? I'll be a little bit slow here. We will maintain our own living space. We all maintain our own living spaces. Each of us have a preferred ways of doing things. And we have specific cleaning supplies that we might especially like. What are the cleaning supplies? Some love to use jig, some love to use Dettol, some love to use different cleaning and disinfecting agents. Okay. So we like to perform household tasks in a certain order. You may even feel very particular about other people touching our personal belongings. While a home health aide or personal care aide use the housekeeping skills that they already use to clean their own homes, they can also learn new ones in this course. Remember, cleaning another person's home is very different than cleaning your own home. I repeat, cleaning another person's home is very different than cleaning your own home. So the way a home health aide or personal care aide do things may be very different from the way their patients does or the way their patients prefers to have them done. So remember though that there is more than one way to complete a task. Uh, it always takes a two, two to tango according to the saying. So it's not only one way to do things, there are many ways to do a single task. So remember also that the patient's preferences are always correct and they must be respected. So home health aides or personal care aides must always be conscious, that means they must be aware of respecting their patients' belongings, respecting their preferences, and also respecting their cultural values and practices. So this is an example of someone, a home health aide or personal care aide, helping with floor cleaning, bedroom cleaning, just home care generally. So home health aides or personal care aides will be using equipment and cleaning supplies from that are different from their own, and they should find out how to use their patient's equipment correctly. You may go to a house, you probably even sweeping your floor with broom, and you get to a patient home where he uses automated you know dirt collector, where this will just extract the dirt and not put it in the bin. You need to learn to use this equipment. So ask the patient to explain how to use it. Give the manufacturer's instruction or booklet to seek assistance from supervisor. Don't be too proud or too big to ask, because if you're too big to ask, you're not to be too big to secure some cost. If you malhandle an equipment and it gets faulty, you have to what? To pay for it. So they should ask their patients to tell them how they would like their home to be clean, how would they like their home to be arranged, how would they like their supplies to be clean. Also, how would they prefer them to use the equipment. So home health aides or personal care aides must remember when completing tasks in which they must move the patient belongings to always put them back where they were. They shouldn't take it upon themselves to rearrange their patient belongings or furniture. Think about how you might feel if someone came into your home and started rearranging your things because they thought their ways was best. So imagine put yourself in the patient's shoes. Don't just change patient's style. Ask them, and if they want to change their style, fine, then you can. But if you don't change the style. Handle the patient and family belongings carefully, replacing the items, especially the equipment, it can also be very what expensive. So be very, very careful when you want to replace those equipment. It can be expensive and the cost is going to be on you. If by venture you develop fault based on your carelessness. Now, while it is important to encourage independence and support a patient's ability to perform household tasks independently, home health aides or personal care aides should always be sensitive to their limitations. We all have a limitation. There is a limitation you must not breach. So they may not be able to physically complete a task that others may find very simple. They may not also be able to psychologically handle the extra burden or stress of cleaning or performing other household tasks. But don't be judgmental about their abilities. Instead, as a home health aide or personal care aide, you should work with them to find those tasks uh, that they can do. Find out what they can do and make it even more convenient for them to do them. Find creative ways to adapt tasks to their abilities. For example, a patient may not be able to stand for long or for a long time. However, they may be able to very successfully perform many household tasks while seated. They could fold laundry, they could iron clothing, they could prepare foods, and could even vacuum from a seated position. So this is the end of the slides. But just a brief recap and a little more summary to what we discussed. Helping the patient maintain a clean home increases their comfortability as well as their uh, the self-esteem, like we mentioned, and also prevent them from illness. But everything has what a technical know-how. So we are not to take it into our hands when caring for the patient. If you notice so far, things that have been common in our sayings is we are not completely independent of duties. What do I mean? We are not handling duties independently. We have a guideline, that's the care plan. We have a supervisor to report to when there is need, and we have our patients to consult. Always consult your patients before you take decisions. So even when it comes to home care, house cleaning, and the likes, always consult your patients. Let's say fine, patient is not someone who values cleanliness and cleanliness or tidy environment. Whereas I don't think there's anyone who doesn't love a tidy environment. Only if they can perform it for themselves. Everyone appreciates that. You help your patient to understand the importance of what? Of a tidy up environment, the clean environment, of a disinfected environment, or an infection-free environment. So briefly, we talked about in the whole module, we started with the topic which is introduction to care of the home and personal belongings, and we were introduced to the topic. Then we talked about importance of housekeeping, where we mentioned some cleaning do's and cleaning don'ts. And we talked about performing housekeeping. How do we perform housekeeping? And we mentioned the fact that you don't change the patient's you don't just come and tidy up and change the patient's arrangement. You just do your things. You have to what? Conduct your patient and take the patient along as much as possible. And also allow them to perform tasks that they can perform for themselves as much as possible. Thank you for your time. We have come to the end of the lecture. Have a wonderful day. Okay.